Hello guys, welcome back. Hope you all are doing absolutely fine. So today we'll be continuing with our pathology exam revision series with our next topic, which is pneumonias. Pneumonia definition. Pneumonia is defined as acute inflammation of the lung parenchyma distal to the terminal bronchioles. The terms pneumonia and pneumonitis are often used synonymously for inflammation of the lungs. Pathogenesis. The microorganism gains entry into the lungs by one of the following four routes: inhalation, aspiration, hematogenous spread, and direct spread. The normal lung is free of bacteria because of the presence of a number of lung defense mechanisms at different levels. Failure of these defense mechanisms and presence of certain predisposing factors results in pneumonias. These conditions are as of under: altered consciousness, depressed cough and glottic reflex, impaired mucociliary transport, impaired alveolar macrophage function, endobronchial obstruction, immunocompromised states. Classification: etiologic: bacterial pneumonia, lobar pneumonia, bronchopneumonia, legionella pneumonia, viral and myocardial pneumonia, fungal pneumonia, which is further into pneumocystis pneumonia and others, non-infective pneumonias, aspiration pneumonia, hypostatic pneumonia, and lipid pneumonia. First one, bacterial pneumonia. Bacterial infection of the lung parenchyma is the most common cause of pneumonias or consolidation of one or both of the lungs. Types of bacterial pneumonia are lobar pneumonia. Lobar pneumonia is an acute bacterial infection of a part of a lobe, the entire lobe, or even two lobes of one or both the lungs. Etiology. Based on the etiologic microbial agents causing lobar pneumonia, following types of lobar pneumonia are described. Pneumococcal pneumonia. More than 90% of all lobar pneumonias are caused by Streptococcus pneumonia, a lancet-shaped diplococcus. Staphylococcal pneumonia. Staphylococcus aureus causes pneumonia by hematogenous spread of infection from another acquired infections. Streptococcal pneumonia. Beta hemolytic streptococci may rarely cause pneumonia, such as in children after measles or in influenza. Pneumonia by gram-negative aerobic bacteria. Less common causes of lobar pneumonia are gram-negative bacteria like Haemophilus influenza. Pseudomonas commonly causes pneumonia in children below 3 years of age. Morphologic features. Lobar pneumonia divided into four sequential pathologic phases. Stage of congestion is the first one, which is the initial phase. The initial phase represents the early acute inflammatory response to bacterial infection that lasts for 1 to 2 days. Grossly, the affected lobe is enlarged, heavy, dark red, and congested. Histologically, typical features of acute inflammatory response to the organisms are seen. These are as under: dilatation and congestion of the capillaries, pale eosinophilic edema, few red cells, neutrophils, red hepatization, early consolidation. This phase lasts for 2 to 4 days. The term hepatization is pneumonia refers to the liver-like consistency of the affected lobe on cut section. Grossly, the affected lobe is red, firm, and consolidation. The cut surface of the involved lobe is airless, red, pink, dry, granular, and has liver-like consistency. Histologically, the following features are observed: the edema fluid of the preceding stage is replaced, marked cellular exudate of neutrophils and extravasation of the red cells. Many neutrophils show ingested bacteria. The alveolar septa are less prominent. Grey hepatization, late consolidation. This phase lasts for 4 to 8 days. Grossly, the affected lobe is firm and heavy. The cut surface is dry, granular, and grey in appearance with liver-like consistency. Histologically, the following changes are present: the fibrin strands are dense and more numerous. The cellular exudate of neutrophils is reduced. The red cells are also fewer. The organisms are less numerous and appear as degenerate forms. Resolution. This stage begins by 8 to 9 days if no chemotherapy is administered and is completed in 1 to 3 weeks. Grossly, the previously said fibrinous constituents is liquefied by enzymatic action, eventually restoring the normal aeration in the affected lobe. Histologically, the following features are noted: macrophages are the predominant cells in the alveolar space, while neutrophils diminish in number. Alveolar capillaries are engorged. There is progressive removal of fluid content as well as cellular exudate from air space. Complication: organization, pleural effusion, empyema, lung abscess, and metastatic infection. Clinical features. Classically, the onset of lobar pneumonia is sudden. The major symptoms are shaking, chills, fever, malaise with pleuritic chest pain, dyspnea, and cough with expectoration, which may be mucoid, purulent, or even bloody. Bronchopneumonia. Bronchopneumonia or lobular pneumonia is infection of the terminal bronchioles that extend into the surrounding alveoli, resulting in patchy consolidation of the lungs. Etiology. The common organisms responsible for bronchopneumonia are Staphylococci, Streptococci, Pneumococci, and Pseudomonas. Morphologic factors. Grossly, bronchopneumonia is identified by patchy areas of red or grey consolidation affecting one or more lobes. Histologically, the following features are observed: acute bronchiolitis, suppurative exudate, thickening of alveolar septa, less involved alveoli, contains edema fluid. Complications. The complication of lobar pneumonia may occur in bronchopneumonia as well as there is generally some degree of destruction of the bronchioles, resulting in foci of bronchiolar fibrosis that may eventually causes bronchiectasis. Clinical features. The patient of bronchopneumonia are generally infants or elderly individuals. The signs and symptoms are similar to those of lobar pneumonia appear. Please note the spelling change in the sign. Legionella pneumonia. It is an epidemic illness caused by gram-negative bacilli. Morphological features. Grossly, there are changes of widespread bronchopneumonia consisted many lobes and there may be consolidation of the entire lung. Histologically, the changes are not distinctive. Common features are as under: alveolar septa show foci. The organism may be demonstrated in the macrophages by special stain. Clinical features. The disease begins with malaise, headache and muscle aches, followed by high fever, chills, cough and tachypnea. Viral and mycoplasmal pneumonia. It is characterized by patchy inflammatory changes largely confined to interstitial tissue of the lungs without any alveolar exudate. Thank you.